In clinical environments, learning opportunities arise every day. Talk is a structure that guides a learning conversation between team members following a case or clinical session. This dialogue is called clinical debriefing. It should be a short, focused discussion lasting no more than 10 minutes. It could take place immediately after a case, at the end of a clinical session, or later at a suitable time. Having a talk conversation may be useful following good outcomes after difficult cases, when team members are exposed to new clinical experiences, after near misses or serious untoward events, or in other situations. Talk gives a structure to the discussion so that it is carried out constructively and focused on a common goal. Any team member familiar with the structure may lead the conversation. Clinical debriefing should ideally take place in quiet and private areas, and intended in a blame-free manner. The conversation should focus on learning and improving patient safety, respectfully, avoiding negative comments and identifying positive actions and behaviours, valuing everybody's input, identifying small objectives and following up outcomes step by step. We use talk to find practical solutions for improvement. These small changes impact positively on both teams and the organisation.